And meanwhile, I request all the participants for your active participation, and please post your queries on the Dropbox of the Shield Connect page. So once the talk will be over, we shall have a short discussion on this topic with Madam. So thank you very much, Madam, once again for your valuable time on our academic platform, that is Shield Connect. And over to you, Madam, for further proceedings. Thank you very much.
Thank you, Suman, so much for your kind words. So, but my audio is not on. Sorry, video.
Madam, your video is not coming. But audio is okay, Madam.
Am I visible? No. So video is not there, I think.
Madam, your screen is visible, but video is not coming, madam.
Or like this.
Ma'am, you can start.
Okay. So good evening all.
Madam, we guess that there is some network issue or something is there, so we cannot see your slide deck.
I think Madam has disconnected, I think, due to some network issues. We need to wait for some time.
Yeah.
Can you give me Mr. Suman?
Yeah, ma'am.
Am I?
Yes,
yeah,
madam.
your video has come now.
You're
You can connect, ma'am.
But my slides are not.
Ma'am, same process, madam. You can go to share screen.
Yes.
Yeah.
My slides are visible.
Yes, madam. Your slide is visible. So can you
Let me continue this way. Okay.
Okay, madam.
If I am going to full screen, no, the other slides are not getting said. I think some problem is there.
Okay, ma'am. Please continue, ma'am.
So sorry for all these network issues. We are delayed by 5 minutes. So good evening to all, and it's my immense pleasure and privilege to present this topic before you all. So let us start. What is menopause? Menopause is a normal natural event defined as menstrual period confirmed after 1 year of stoppage of menstrual bleeding. It also represents a permanent cessation of menses due to losses of ovarian follicle function, usually at the age of 50. And naturally, the average age is 51. It also occurs due to prematurely due to medical intervention like bilateral hysterectomy, patient taking chemotherapy, or due to any impaired ovarian function. Premature ovarian failure also causes premature menopause. So this is the straw stage of reproductive age. In this straw staging, whole female life broadly is divided into 3 phases. That is reproductive phase, menopausal transition phase, and post-menopause phase. Each phase has 3 stages, 2 to 3 stages. Early, peak, and late. Reproductive phase, in early phase, -5 menstrual cycle is variable to regular, and -4 and -3 stage, menstrual cycle is almost regular, and the hormonal level, there is normal to increase FHS level. Menopause transition in -2, that is in early phase, there is variable cycle. Variable cycle length increase meaning more than 7 days or more than that. And in the late stage, cycle may be skipped for 2 cycle may be skipped with an interval of more than 6. Increase AMH. Post-menopause, there is complication of menstruation and FHS and increase AMH. This graph shows, I think,
Madam, your voice is breaking some.
I think Suman, yeah, network issues are there, it seems. I think Madam has connected again back.
Yes, huge network issue is there.
Yeah.
So sorry, there is some network issue, so we'll be coming back shortly.
Mr. Suman, can you spare 5 minutes to me? I'll get connected to the Wi-Fi. Now
Yes,
I'm
madam.
operating on mobile hotspot. That's why there is some problem.
Yes, madam. Okay, no problem.
Sumanji, can we, okay, we cannot stop no live for some time.
Hello.
Yes, madam, you are audible.
Yeah. Just I'm bringing the slides, PPT slides over the screen.
Sure, sure.
Yeah. So, as this graph shows, gradually since years, the age of
Sorry, madam,
life.
your slide is not visible. It is visible now, madam.
Is it visible? Slides?
Yes, madam. It is full screen.
Am I audible?
Yes, everything is fine.
Yeah, fine. So, since long years, our life expectancy has increased, but the age of menopause has remained constant, that is between 45 to 55, as per this graph represents. So what are the status of serum hormone levels at menopause? There is decreased circulating estrogens, the decreased ratio of estrogen to androgen, decreased sex hormone binding globulin secretion, increased peripheral aromatization of DHA to estrone, and reversal of estradiol to estrone ratio, but no significant change in testosterone level. This is the pictorial representation of estrogen receptor, showing different nuclear localization domain, binding sites. Estrogen receptors are of two types, alpha and beta. In most part of our body, both alpha and beta estrogen receptor is present, as seen in the picture, except in liver, there is only alpha receptor, and in the GI tract, it is beta receptor. So what are the effects of estrogen at various sites? Sorry. What are the effects of estrogen at various sites of our body? At the bone level, estrogen causes increased deposits of calcium into bone, thereby increasing the bone density. At brain, it blocks the release of ovarian estrogen. Breast, it stimulates the growth of breast, thereby increasing the size of breast and increasing the sensitivity of breast and risk of breast cancer. Blood increase, there is increased risk of blood clots due to estrogen. Blood in cholesterol metabolism, estrogen increases the good cholesterol, that is HDL, and decreases the bad cholesterol, that is LDL and VLDL. Skin, it makes the skin softer by increasing the fat deposits. Stimulates the endothelium of uterus, thereby causing heavier cycles and increased risk of uterine cancer. And in vagina, it increases the thickening of skin and better blood supply to tissue, where leading to vaginal discharge and feelings of pelvic congestion. But the lowering of estrogens in our body causes, or absence of estrogen stimulation causes osteoporosis, hot flushes, sleep disorder, mood changes, problems with memory and Alzheimer's disease, smaller breast, but there is no change in clotting. And the good cholesterol are decreased and bad cholesterol like LDL, VLDL are increased. There is thinning of skin, liver spots and dry skin, cessation of menstruation, that is menopause occurs, and there is dryness and vaginal infection, painful sex, incontinence of urine and pelvic weakness. What are the estrogen effects of estrogen loss on our health? So, as the age advances, gradually estrogen secretion in our body decreases and it comes to down at around age of 50 to 55. So, in the early phase, certain short-term symptoms are there, and long-term there is long-term disease develops. Short-term symptoms are hot flushes, mood changes, sleep disturbances, and certain acute cognitive changes. Some urogenital symptoms and skin changes also occur. And in the long term, the diseases that develop are cardiovascular disease and osteoporosis. And finally, in the long run, cognitive decline or Alzheimer's disease develops. So let us know something about the physiology behind the menstruation and menopause. since our birth, each ovary contains millions of eggs or oocytes, which steadily decreases until we are approximately 50 years old, when the stocks become exhausted. During the perimenopause phase, follicular activity phase, estrogen levels decreases and pituitary gland produces increased amount of LH and FHS due to negative feedback. Thereby the cycles become anovulatory, follicular development stops, the endometrium is no longer stimulated, and amenorrhea occurs. So by this, natural menopause occurs where the ovary stops producing eggs and makes less of the female hormone, that is estrogen, and the symptoms all menopausal symptoms we explain are due to low level of estrogen, and it signals the end of the fertile phase of a woman's life. What are the symptoms of menopause? The symptom starts around 2 years prior to the menopause and get its peaks 1 year after and returns to normal after 5 years. The symptoms varies widely. The symptoms are menstrual irregularity. Menstrual irregularity, there may be shortening of length of the cycle or lengthening of the cycle, hot flushes and sweats. What are hot flushes? Hot flushes is sudden feeling of heat in the upper body, spreading upwards and downwards with patchy flushing of the skin, followed by palpitation and sweating, and should last for a few minutes. Then there is sleep disturbances. Sleep disturbances occurs due to night sweats and can lead to irritability, problems with short-term memory and concentration. Vaginal dryness that's like a discomfort, dryness of vagina, dyspareunia, and irregular symptoms like recurrent UTI and stress incontinence, urinary urgent incontinence also develops, mood changes, loss of libido, osteoporosis and CVD and stroke risk increases. So these menopausal symptoms all are self-limiting, usually last between 2 to 5 years and may last longer. So besides natural menopause, before the age of 45, also menopause occurs in certain persons. And this premature menopause occurs in case of primary ovarian failure, surgically induced menopause like bilateral oophorectomy, patient on taking radiation and chemotherapy, and it may be linked with smoking and low risk socioeconomic groups, BMI, family history. And for this, primary ovarian failure may occur at any age and usually no cause is found. It may be linked to chromosomal abnormalities, autoimmune disease, enzyme deficiency, and it affects 1% of women in less than 40 age group and 0.01% of women in less than 30 age group. 5 to 15% of women with primary ovarian failure may retain intermittent ovarian functions for years, and spontaneous ovulation pregnancy are possible. So coming to the management of menopause, we focus on 4 factors that are reassurance, education and lifestyle changes, HRT, and others. Reassurance, proper counseling is very much needed with full of patience, compassion and empathy with the patient. Education and lifestyle changes, HRT, and others. So what are the lifestyle changes? Lifestyle changes in all the menopausal symptoms, regular exercise and adequate sleep is very much needed, and avoidance of triggers like spicy foods, caffeine, alcohol, smoking should be avoided to improve the menopausal symptoms. Coming to HRT, before prescribing HRT to a patient, certain principles should be followed. Consideration of HRT should be part of an overall strategy, including lifestyle recommendation regarding diet, exercise, smoking cessation, safe level of alcohol consumption for maintaining the health of peri and postmenopausal women. HRT should not be recommended without a clear indication for its use, that is significant symptoms or physical effects of estrogen deficiency. Postmenopausal HRT is not a single regimen that should be given to a woman. HRT before prescribing HRT, it should be individualized, tailored according to symptoms and the needs for prevention, as well as personal and family history should be evaluated. Results of certain investigations should be carried out, and it should be given as per the woman's preferences and expectations. Proper counseling, as I said before, proper counseling is needed. Women taking HRT should have at least once a year full body checkup, all updating the medical and family history, all relevant laboratory investigation and imaging investigation should be carried out, and a discussion of lifestyle should be carried out, and strategies to prevent or reduce chronic diseases should be maintained. What are the indications of HRT? HRT is given to relieve severe menopausal symptoms, for prevention of osteoporosis, to maintain the quality of life in menopausal years. Special group of women to whom HRT should be prescribed are premature ovarian patient with premature ovarian failure, gonadal dysgenesis, surgical or radiation menopause. If patient is having uterus, then estrogen and progesterone combination should be given. Not only estrogen should be prescribed. If patient is not having a hysterectomy has been undergone in the patient, then estrogen alone can be provided, and vaginal estrogen therapy is useful for women who have local symptoms such as vaginal dryness. So certain key points should be followed while prescribing HRT. Primary use of any form of HRT is to control menopausal symptoms only. HRT should not only be prescribed for the short-term relief of menopausal symptoms, and should only be prescribed for the short-term relief of menopausal symptoms and prevention of osteoporosis. HRT should not be prescribed in the hope or expectation of any protection against arterial CVD or Alzheimer's disease. Oral and non-oral estrogen have different metabolic profiles that may impact on side effects and therapeutic risk. There are many preparations for HRT, combined estrogen and progesterone preparation, and they have different metabolic profiles in comparison to estrogen alone. There is increased risk of breast cancer, and it depends upon the duration of use, of course, use of the preparation estrogen and progesterone. But Ebola has significantly smaller risk of breast cancer compared to estrogen and progesterone preparation. The role of HRT is very much needed in this following condition, that is natural menopausal symptoms, premature menopause, surgical menopause, other causes of estrogen deficiency under age of 50 years, menopausal women at significant risk of osteoporotic fractures, but contraindication and risk should be carefully evaluated before prescribing HRT. So HRT are available in many forms like tablets, creams, patches, gel, and the oral HRT is given in two forms: cyclical combined, continuous combined, unopposed estrogen. Cyclical combined pills are given patient having regular menstrual periods, and continuous combined preparation is given in patient having amenorrhea for more than 1 year. Of course, if there is bleeding within 3 to 6 months, then further investigation is required. Unopposed estrogen is given only to those women who have no interest. So what are the conditions where HRT should not be given? They are breast cancer, endometrial cancer, untreated endometrial hyperplasia, undiagnosed vaginal bleeding, thromboembolic disease, arterial disease, active thrombophlebitis, liver disease where LFT has not returned to normal, in pregnancy and breastfeeding, and HRT should be stopped 4 to 6 weeks prior to surgery and should be restarted when fully patient become mobile. So these are the same thing. What are the risks of hormone therapy? The risks are there may be chances of development of endometrial cancer, venous thromboembolic disease, which occurs, and the risk increases within 1 to 2 years after initiation of hormone. Breast cancer, increased breast density with progesterone via proliferation of estrogen-dependent mammary tissue, making it more difficult to detect breast cancer early with a mammogram. ovarian cancer. It occurs if it is used for more than 10 years. Cerebrovascular accidents and lipid metabolism, increased chance of gallbladder disease, and more development of more increase of bad cholesterol, that is VLDL and LDL, and decrease HDL, leading to cerebrovascular accidents. Besides HRT, other supplements that are given are calcium, vitamin D, biphosphonates. In biphosphonates, alendronate is given and zoledronic acids are given. Alendronate is given at the dose of 70 milligram per week, and after taking this, patients should sit upright for 1 hour. And zoledronic acid is given in the dose of 5 milligram, infusion over 15 minutes, and it is given yearly once. Other complementary therapy are herbal products. When these herbal products are given, when patient is not fit for hormone therapy or patient refuses to take hormone therapy. As per this Caspian Journal of Internal Medicine study, it has shown that menstruating patient or patient having periods suffers less severe COVID-19 infection than patient with menopause. And menstruating patient has greater longevity and protection against certain disorders, health risk factors like heart disease, cerebrovascular accidents, and COVID-19 infection. What are the other alternatives that can be as per the menopausal symptoms could be given are Tibolone. As it said before, it is a synthetic steroid with weak estrogenic, progesterogenic, and androgenic properties. This is much safer than the combined estrogen and progesterone pills as HRT. And clonidine, it is the alpha-2 agonist, and it enhances the effect of anxiolytics and should not be used with alcohol. It helps in relieving the vasomotor symptoms. Then SSRI can reduce vasomotor symptoms also. Gabapentin reduces severity and frequency of hot flushes. Progesterone may improve hot flushes, but there is a chance of development of breast cancer. Repellents, these are the vaginal adhesive moisturizer. And SSRI, it has been studied that it gives 60% relief than 30 in comparison to 30% in case of placebo. Gabapentin reduces the frequency of hot flushes by 45% and severity by 54%. So coming to natural herbs, in these natural herbs groups, there are phytoestrogen and black cohoes. Phytoestrogens, they are structurally similar to estradiol, but its efficacy, regarding its efficacy, data available are insufficient. Black cohoes comes from buttercup family. It reduces the hot flushes and other symptoms. Still, its data is also insufficient to prove it. And progesterone creams can also be given. Acupuncture gives a lot of relief. It is seen that in a study, after consuming 3 to 4 times a day soya protein, it is associated with decrease in hot flushes and improvement of menopausal symptoms. Then MENQOL, this is the menopause specific quality of life questionnaire. This is introduced in 1996 as a tool to assess health related quality of life in the immediate post-menopausal period. An inherent assumption of the MENQOL is that disease states and conditions like menopause which produce symptoms may disrupt emotional, physical, and social aspect of an individual's life, which must be considered concomitantly with the treatment decisions. The MENQOL improves upon several instruments, and it uses the instruments like Kupperman Index and General Wellbeing Skill to assess the impact of menopausal symptoms in the following ways. That is, specificity to the condition of menopause, item development based upon women's own qualitative and quantitative accounts of menopausal symptoms, Inclusion of all pertinent domains of the menopause experience, including sexual system, the symptoms, and demonstrated reliability and validity. The certain lifestyle intervention should be adapted to improve the quality of life during menopause. Lifestyle modifications first is maintenance of healthy weight. Though menopause does not increases the weight gain, but in studies it has been seen that increase in weight gain increases the severity of vasomotor symptoms. In case of breast cancer survivors with post-diagnosis weight gain, at greater risk of reporting hot flushes than women who did not gain weight. And another study of 40 obese women, it has been seen that a 10% weight loss resulted in significant improvement in hot flushes with a correlation between weight loss and reduction in hot flush frequency. Then another modification is cooling. It has been seen that little bit elevation of small body core temperature can trigger vasomotor symptoms. So it makes sense to propose environmental and lifestyle changes that lower core body temperature and prevents it from rising. The changes that should be adapted are wearing dress material like cotton cloth. It should be made of natural fibers, avoidance of tight fit dresses, using a hand fan or electric fan, keeping cooler at night, lowering the room temperature, putting a cold pack under the pillow, turning the pillow over to the cool side when feeling warm, using dual control electric blankets, and using a bed fan that blows air between the seats and drinking cool liquids such as ice water. Triggers like smoking, spicy food, and alcohol, all this should be avoided. Smoking has been reported as a risk factor for vasomotor symptoms. Smoking cessation may help to alleviate mild symptoms, but there are no clinical trials evaluating this intervention. Alcohol can also trigger hot flushes, and some women find that their flushes are reduced when they avoid drinking alcohol. Regular exercise helps a lot. It improves the quality of life, improves the cognitive functioning, decreases the depression, improves the sleep pattern, decreases fatigue, increases the bone density, maintains healthy weight, and prevents cardiovascular diseases. Certain mind and body based therapies are also adapted for menopausal symptoms. One is cognitive behavior therapy. Group and individual cognitive behavior therapy are both effective at reducing the impact of vasomotor symptoms and at improving sleep and general well-being. This approach could potentially be used in conjunction with other therapies for menopausal symptoms. Yoga. Definitely, yoga is very much useful for every group of individuals, and in menopause, it helps a lot. And that's why yoga is nowadays introduced in all centers. Yesterday only, we celebrated our International Yoga Day, 8th International Yoga Day. There is mixed evidence that yoga is effective for the management of vasomotor symptoms and sleep disturbances. So these are the, as you see in the picture, these are the different yoga positions that helps a lot. In a systemic review and meta-analysis report showing the relationship between exercise and quality of life in women, shown that yoga and pelvic floor muscle training exercises improves the horizontal symptoms and other menopausal symptoms in women. Then paced breathing. What is paced breathing? In paced breathing, short and deep inhale breath is taken, and that is abdominal breathing, and long exhale breath is taken, and it should be done for 15 minutes twice daily. It helps a lot in menopausal symptoms, and it reduces the feelings of anxiety also and hot flushes. So as shown in the picture, the inhale breath is short and abdominal type, and the exhale breath is slow and long. So what is Menopause factor? Menopause factor is the rating scale to assess for menopausal depression. The Menopause factor analysis identified for 5 subscales of the Menopause, that is self, somatic, cognitive, sleep, sexual, with high internal consistency, discriminate validity, and a good construct and conversion validity. Factors analysis indicated that Menopause is composed of 5 factors, each with good relevance. The first factor represents self and is comprising the following items: self-esteem, isolation, paranoid thinking, and anxiety, and allows assessment of whether the patient is expressing paranoid thinking such as guilty feelings or suspicious thoughts, decreased self-esteem, poorer self-esteem, less interest in socializing, and feelings of anxiety. The second factor is sexual. It refers to changes in libido and sexual activity, as well as assessing whether the patient is experienced a decrease in energy. Then comes the third factor, somatic. It reflects the physical pain and changes in body weight. Cognitive factors captures any subjective changes in memory and concentration. And the final factor, sleep, monitors any increase in irritability or there is any other sleep disturbances. Certain relaxation exercise also helps a lot. And hypnosis was more effective than an intentional control comparison. Hypnosis also, it's a method which improves sleep and heart process. Other therapies that can be adapted are acupuncture, magnetic therapy, reflexology, chiropractic intervention, which improves the health. Chiropractic helps in improving the health, sleep, stress, happiness, well-being, body immune system, and mobility, proper mobility of all body parts, and it decreases the illness, pain, aches, injuries, and bad posture, depression, others. So medical herbs with the following ingredients in the following proportion, certain proportion, has proved to that it helps a lot in relieving the menopausal symptoms. These medical herbs are cinnamic acid, S-methyl ester, dicursin, and dicursinol angelate. These medical herbs, the mode of action are, it upregulates the estrogen affinity to estrogen receptor in non-reproductive target organs like artery, CNS, and bone, thereby reduces the hot flushes, night sweats, improves the mood swings and insomnia, and improves the bone marrow BMD. And it downregulates the estrogen affinity in the reproductive target organs like uterus and breast, thereby decreasing the risk of endometrial cancer and breast cancer. Evidences shown that by this medical herb group, there is decrease in relief of symptoms like vaginal dryness, hot flushes, mood swings, bone pain, if patient takes this medical herbs, and it relieves within 7 to 14 days. Thank you.
Thank you very much, madam, for this nice presentation. Just give me 1 minute time, ma'am, to check the questions, if any.
Yeah, sorry for the network problem.
It's fine, ma'am. It's fine. Just give me 1 minute time. Madam, one question is, how do you tackle this surgical menopause, say in early age?
Surgical menopause early age, that is before age of 45, if you mean. In that case, definitely HRT should be given. First of all, proper counseling to the patient should be done. Reassurance should be given with all a lot of empathy and compassion. Then we will next proceed for lifestyle changes like exercise, regular exercises, calcium, vitamin D, and taking other biphosphonates. If patients, besides that, If a patient still persists with the menopausal symptoms, then we can go for the HRT.
And ma'am, how long can this HRT be given to that particular patient for reduction?
HRT should be given till the patient gets relief from the menopausal symptoms. It should not be given for longer time.
Thank you very much, ma'am. And is there any other mode of treatment you used apart from this HRT? Any plant-based extract or some other things?
As I said, there are certain medical herbs that helps and they have lower risk of endometrial or breast cancer, and that can be prescribed in patients, those who do not want to take HRT or not fit for HRT.
Thank you very much, ma'am. And just one question is, ma'am, as most of the people is facing these hot flashes. So what will be the treatment strategy to reducing these hot flashes, and particularly in the cognitive impairment in case of menopausal women?
Cognitive hot flashes, maintaining cooler environment around us, that should be started. If patient does not get relief from that, then we can hot flashes can be treated with gabapentin or clonidine, like gabapentin. And cognitive therapy, that is, I think, more valuable for cognitive therapy. Regular exercise and adequate sleep is very much needed to maintain the memory and concentration of the patient, rather than any medical therapy.
Any medical therapy. Okay. Thank you very much, ma'am. So, ma'am, I could not find any other questions. So, if you allow us, then we can conclude this session.
Okay. Thank you.
Thank you very much.
Madam, thank you, madam. Thank you. Your presentation was really excellent. Thank you, ma'am.